Welcome back, everyone. Before we begin today's show, I'd like to tell you about the Legends of Health conference. The conference will now be held online due to the coronavirus situation. This is a great opportunity for all of you around the world to join me live online for my 4 life-changing, life-saving events. There will also be 9 other world-leading health lecturers there to share with you life-changing, life-saving information. My first lecture will be Friday, May the 1st, from 4 p.m. to 5 p.m. Pacific Standard Time, and it will be called Mind Over Medicine. On Saturday, May the 2nd, 11 a.m. to 1 p.m., my 2-hour lecture, and it will be called How to Thrive and Stay Alive on Planet Earth. And then on Thursday, May the 7th, from 6 p.m. to 7 p.m., it will be called Inflammation is a Scar Tissue Issue. And then on Saturday, May the 9th, 8 a.m. to 9 a.m. Pacific Standard Time, Creating the Perfect Day for the Perfect Life. For more info, please go to docofdetox.com to the events page. There you will find the link to get your ticket at a greatly discounted price of $97. So join me for the Legends of Health webinar series and enjoy today's show. God bless. Good day, everyone. Welcome back to the Doc of Detox show. I'm Dr. Darrell Wolfe, and today's show is Remove the Splinters and Watch the Body Heal with a really great friend of mine, Dr. Gerald Smith. But before we begin, I would like to talk about the Legends of Health conference in Markham, Ontario. This life-changing 4-day event takes place from April the 30th to May the 3rd. During this time, I will be delivering 4 comprehensive lectures. The first one is an all-day lecture called How to Thrive and Stay Alive on Planet Earth. And if you've ever wanted to learn the rules of this life-challenging Earth game, then you won't want to miss this lecture. Okay, my other 3 lectures are Inflammation, to Cancer, a Scar Tissue Issue, Mind Over Medicine, and Create the Perfect Day for the Perfect Life. I will also be speaking on the panel of experts. For more information, please go to the events page on docofdetox.com. From there, you will be able to purchase, guess what? Discounted tickets. These tickets are regularly $300, and you can get them from me for only $97. And guess what? We only have 15 tickets left, believe it or not. And then the rest will go back to the normal price. Now, my dear friend Dr. Smith will be holding a workshop on Thursday, April the 30th, at the Legends Conference called Quantum Nutrition and Removing Splinters from 9 a.m. to 5 p.m. Dr. Smith will also be talking on the Legends of Health stage Friday, May the 1st at 6 o'clock until 7, and that's called Breakthroughs in Quantum Holistic Dentistry. Now, before we start, I just want to say something, and that is this. The information that you're going to get about dentistry from Dr. Gerald Smith is probably the most leading information that you're going to find in dentistry in the world today, okay? And you have to understand something. The dentistry, like the medical system, sometimes you want to love them and sometimes you know what I'm talking about here. And I'm going to tell you something. To find a high integrity dentist with real strong morals today, I don't know. You know what? You really got to look around, all right? I'm going to tell you something before we start with Dr. Gerald Smith. I have someone here, and I just want to tell you this. This is not all dentistry. This isn't anything that we do, but it's called buyer beware. So we do personal treatment and trainings here, where people come for 7 days, and we totally go in on an emotional, physical, nutritional level, and we show them how to create that perfect day. Well, so she comes in yesterday, and I talked to her, and of course, she's got breast cancer, like so many women do. 20 years ago, she went to a dentist and she said she wanted her amalgams out. He said, I'll do it. Now, I understand this is not what it's all about, but I'm telling you, You need to challenge me with my information. Okay. You need to challenge everyone that's in authority over your body about their information. And if you don't get that, then you're in trouble. Okay. She went to a dentist 20 years ago and he said he was going to take the amalgams out. Okay. The so-called silver amalgams that aren't silver, they're 50% what? Well, we'll be talking about that, I'm sure, today. Anyways, guess what? She was diagnosed with breast cancer just about what? 2 years ago? And guess what they found out? So they found out that he went in there and underneath the crowns, he never took the amalgams out. He didn't replace them. So here she had for 20 years on the same side, and they said, you've got to have silver amalgams because there's no way that this cancer could be festering like this unless there's something else going on if you're eating such a good diet. So they took the crowns off and there they were. So understand something. You make sure that anybody's in authority of you, whether it's your government, the medical system, okay? Myself, anyone who tries to tell you how to go in and they work with your body or show you how to work with your body, you better make sure that their information is right. There's a lot of people out there that give information and their heart's in it. But guess what? The information is wrong. So let's begin the show. Dr. Gerald H. Smith is a recognized international dental authority on cranial, mandibular, somatic disorders with a focus on resolving chronic pain. And I'm telling you, I went to a conference and this gentleman definitely knows what he is doing. And he's got magical hands and he holds a degree in natural medicine from the World Organization of Natural Medicine. He is the author of a landmark textbook called Cranial Dental Sacral Complex and the first researcher in the world to radiographically document cranial bone movement by means of the dental orthogonal radiographic analysis system. All right. So here we go. And I will tell you that if you want to listen to somebody who knows what they're talking about and they have your best interest at heart, let's start. Good day, Dr. Gerald Smith.
Good day to you too, sir. Thank you for that wonderful introduction.
Well, it's well-deserved. That's all I can say. It's well-deserved. So if we can get right into this, do you mind telling me about your book, Remove the Splinters, okay, and Watch the Body Heal? And tell me about the book, but what I want to know is what makes your book, Remove the Splinters and Watch the Body Heal, different from the other books out on the market right now?
Well, it's real simple, Darrell. The concepts that I presented integrate osteopathic, chiropractic, dental, medical, physical therapy, vibrational healing concepts, and nutritional principles. So the book integrates these various concepts to uncover the underlying reason for the patient's chronic pain, degenerative diseases, autoimmune, cancer, Alzheimer's, Parkinson's, and many more. See, unfortunately, many books on the market today only focus on symptomatic relief with no real resolution. So in that perspective, I think my book stands alone like an oasis.
So basically your book, it kind of takes the stance of training the patient how to take more power because there's only treatment or giving somebody's power back. So, you know, and because you can go for treatment all your life, but you're only good till the next treatment. So this is an empowering book for our readers, right?
Well, sure. It wakes them up to focus in on real issues. So if there's mental, emotional blockages, and you're an expert in this area, you can alter the way they view life. You know, that's game changer. You know, if you get up in the morning and say, oh, it's raining out, it's horrible, it's this, it's that, all negative concepts, you're sabotaging yourself. You know that. But anyway, this book was written, I guess, out of a little bit of frustration because, like you said, who can you trust? There's very few sources out there anymore that gives you an honest, global view of how the body's working.
Absolutely, sir. And it's not that we should go around distrusting people. It's just that systems and organizations contaminate the information. You know, I would say that, probably 150 years ago, we were a lot better off, okay? Because a medical breakthrough is not a health breakthrough. A technological breakthrough is not a breakthrough. And the only really true breakthroughs that we can give people are giving them back their power. And I think that's what you do. And you show them where the cause, where the root is, instead of going and working on the symptom. It's the same thing as somebody just working on, if they had a breast situation, is just working on the breast area and not looking at the body as a whole, correct?
Correct. In fact, that there was a study done and it showed that 93% of the women with breast cancer had a root canal or some toxic dental issue on the same side.
Well, isn't that, and that's amazing. So, it's all, these breadcrumbs are out there. All you got to do is follow the breadcrumbs. So, do you find that a lot in your practice as well? Do a lot of women come to you with that situation?
Well, we have a multitude of issues. For example, we recently had a woman with cancer of the right lung, and the oncologic surgeon cut off the tip of the right lung, and 6 months later, cancer came back in the left lung. And she said she'd rather die than go through that experience again of the surgery. So what I do is it's really straightforward. It's hidden in plain view. I had to bring in the pathology slide of the cancer. And using energetic testing, she had cytomegalovirus, mercury, and a pesticide in the cancer tissue. Well, I tracked down the cytomegalovirus coming from a root canal tooth on the left side of her mouth. So that was extracted. And then I put her on a nutritional program for the detox the mercury and get rid of the pesticide. Well, 6 months later, the cancer disappeared in the hospital's own records, not mine.
That's amazing. You know what? One of the themes in your book is uncovering the core reason for disease. And that's what you love doing. And thank God you do that. I mean, everybody needs a detective to be their health practitioner. Can you elaborate on this topic?
Yeah, basically, all diseases have a multifactorial cause. And I'm going to give you 10 key causes, excuse me, that we find very prevalent in our practice. One is hypoxia or low oxygen. In fact, all cancers are the same. I don't care if it's brain cancer, uterine cancer, prostate cancer. They're all caused by low oxygen levels. And why is that happening? Real simple. Adulterated oils in our diet are turning our cell membranes into plastic, preventing the oxygen from getting in. And guess what? When the oxygen drops by 35%, you get cancer. So your degenerative diseases like arthritis, cardiovascular, and diabetes, it's all hypoxia, low oxygen. The second big factor is adulterated fats. Any oil you're getting on the supermarket shelf is adulterated, and those corrupt oils are destroying our cell membrane, turning them into plastic, preventing the oxygen from getting in, the waste products from getting out, and the nutrients from getting in. The third major issue is the heavy metals. If you just mentioned, dentistry, unfortunately, is probably one of the biggest terrorist organizations on the planet. This mercury issue is one that's so damn toxic. I mean, if you broke a thermometer in a hospital, you'd have to call hazmat to clean it up. But yet they put it in people's teeth and say it's safe. Well, it's not safe. So between the mercury, the arsenic from the pesticides, the lead, aluminum, cadmium, and nickel, the 6 most prevalent ones, you got some real problems. The mercury in the vaccines, the thimerosal, the aluminum in the vaccines, they're all known neurotoxins, but yet they don't care. The pesticides, insecticides, herbicides, especially the glyphosate, which is one of the biggest offender. I find it in pretty much all my cancer patients and all chronically ill patients. The vaccine toxicity, it's a big issue. I know up in Canada and also in the United States, they're trying to shove it down our throat. And the darn adjuvants that are in there, the aluminum, the polysorbital 80, the thimerosal, the formaldehyde, fetal tissue, pea oil. I mean, you'd think a witch made this damn thing. And the chemicals, about 10 years ago, the Environmental Working Group spent $500,000, Darrell, on 10 newborn babies. They took the blood from their placenta and they analyzed it. They found on average 287 chemicals in the blood at birth. You wonder why these kids have cancer, at 6 months old or a year old, or ADD or any of these other deformities. It's the polluted blood that they're bathing in while they're developing. And of course, nutritional deficiencies. Back in 1929, Congress in the United States ran a study. The soils were depleted in 1929. You're better off eating the cardboard in a box today than eating the contents. Toxicity of dentistry. Oh my God, this is like a wasteland. It's like walking through a minefield. Root canal teeth, mercury fillings, fluoride, toxic resins that they're putting into the teeth, post-extraction infections in the jawbone called cavitations, poorly balanced bites, which affects your spine, your cranium, your pelvis. I mean, dentistry is Neanderthal. I mean, they have no clue what the heck they're doing. They're just drilling holes in people's heads and filling them. Literally.
Who's really running? Who's running the dental association? Because you can't tell me that this blatant healthcare in the mouth is that they don't know. I mean, they know. It's like the medical system. They know what they're doing. I mean, they're the first leading cause of death in North America, and I'm sure the dental. If we were to really take a look at that, I mean, come on, they might be running second here right now.
Absolutely. Well, back in the early 1900s, Weston Price, who was one of the top researchers for the American Dental Association, did a root canal on his own son, 16 years old. In 2 weeks, he died from endocarditis. He then took that extracted tooth that was root canaled in his son. He put it under the skin of 200 consecutive healthy rabbits. Every one of those 200 rabbits came down with endocarditis. They're trashing this guy's research. They're saying that it's bogus. It's not good research. That's the problem. They don't want the truth out there, and they'll bury it, and they'll character assassinate anyone who is telling the truth.
And I'll tell you something. This show is not about conspiracy. Understand? I want everybody to understand that. But right now, you know as well as I do, Dr. Smith, that we are hitting, we are creating a tsunami with everything from dentistry to the medical field to 5G to just everything that's going on. I mean, if people don't take charge on a personal level, I mean, it's up for grabs here. And I got to tell you something. This is my own point of view, and I don't want to make this my own platform, everyone. But you have to understand that there is an evil out there, and they don't care about family. They don't care about you. So you need to get that right now. But I'll tell you something. What is your stand on this? And do you believe that we're going to be able to get the word out to people, because they have to walk away from a lot of these systems? How do we get people to turn away from these systems that are so corrupt? And how in the heck could the Dental Association stay so corrupt? Are they that powerful? Because everybody's talking about this, but why do dentists still do root canals? Why are they putting in these mercury amalgams? Why are they doing all these things that you said, even though they know they're doing them? Is it because of money? Is it because they're being threatened, or what is it?
Well, I think the dental establishment is being controlled by big pharma and the big corporations, and it's like anything else. Those in power don't like to get their feathers ruffled, because if they would start to embrace the concepts that you and I put out there, they'd have to change all their lectures, their slide presentations. That's a painful experience. That's not going to happen in our lifetime. But to answer your question, the way to change the system is to educate the consumer. You got an educated consumer, they vote with their pocketbook. And that's the God's honest truth. And I think that's, and with the internet, that's why they're fearful of the internet, because and they're trashing people's freedom of speech and so forth. The key is the more truth we get out there, the faster the system's going to change.
Absolutely. I want to come back to some of the things that you talk about, and how accurate are conventional blood tests?
Well, there was a study done a number of years ago that reviewed 2,300 autopsy reports. The medical history, believe it or not, accounted for 76% accuracy in making the correct diagnosis. The laboratory tests accounted for only 11% accuracy in making a correct diagnosis. So besides the lack of accuracy, the blood tests really do not tell you what's wrong. It just says something is reacting. It's out of balance.
So what's your way of testing then? Tell us.
Well, I developed a technique called quantum testing where I literally have a vial, have test kits, and each vial has a frequency of a specific substance. So if I have a vial of mercury, for example, and you say, well, you could take an x-ray of a gold crown, but you're not going to see if there's mercury underneath. How the heck are you going to know it's there? Well, simply, if I take a vial of mercury and put it and touch it to the gold crown, and I do a muscle testing technique, if the frequency of the mercury in the vial matches the frequency underneath the crown, a strong muscle will go weak. It's called direct resonance testing. It's much more accurate because no blood test is going to pick that up. And an x ray is not going to pick it up because it's not going to get through the gold. So it is so accurate. And I think this is what's spooking the medical establishment because they do not have technology to get an accurate diagnosis.
Okay, so how often have you been right about that, or is it more often than we would?
Oh, I'm in a high 90% bracket.
Beautiful, beautiful.
Absolutely. Yeah.
That's wonderful. So I'm assuming that you use this approach for defining all diseases, or what other diseases, and how do you do it? How does it different?
Well, I'll give you an example. My own daughter came down with Hashimoto's autoimmune disease, and she told her endocrinologist, "My father's going to take care of it with the alternative. He says it doesn't work." Well, when I tested my daughter with this technology, she had Epstein-Barr trapped in her thyroid, and that's what was causing the so-called autoimmune. Look, you know as well as I do, a healthy body doesn't attack itself. That's nonsense. So there has to be something there. So the body was attacking the Epstein-Barr virus. When I tested the remedies, I put her on a Rife machine, colloidal silver, and noni. And 3 months later, Darrell, all the doctor's blood tests were normal, and she had no more symptoms of Hashimoto. I never got a call because I bruised his ego.
Beautiful. So basically, what you're trying to say, and if I'm wrong, please just tell me that for the integrity of the tissue will decide who lives there, and if the integrity of the tissue is low, then something's going to move in that maybe you don't want, and then it's going to undermine that tissue even more until you can bring up that frequency to give its papers to make it leave. How's that?
Perfect, description. I took a course in lawn care, and one of the statements that rang out and stuck with me was the presenter said, weeds only grow in a soil that's not healthy. And I'm saying, wow, the body's the same way. When your body's toxic with heavy metals, chlorine, fluoride, bromine, PCBs, all these toxic chemicals, glyphosate, you have a prescription for disaster. The immune system gets weak, and these pathogens that are living in our tissue just manifest. So you're absolutely right. When the body gets weak and polluted, then you have disease.
Yeah. So the reality is that when your tissue cells are not at ease, it's not like a signal goes out to a pathogen and it takes an airplane flight up your nose. The pathogen is actually created out of nothing. It's the frequency that creates the pathogen, and then the frequency that gets rid of the pathogen.
Well, if you drink coffee, it'll lower your frequency for 3 days, the caffeine. So people are walking around like they have an appendage. It's called the Starbucks cup. The bottom line is when your frequency is lowered to 52, 55 hertz, you start to come down with the cold and flu. When it gets down to 42, you get cancer. So just think about it. Wouldn't it be neat if we had a simple little instrument that could measure the frequency of the human body instead of doing all these fancy blood tests? Because if you're down in the 40 range or, low 50s, you're headed for trouble. A blood test is not going to tell you these parameters.
Yeah, because the reality is it's really crazy, but we're not really physical beings. We're light energy beings. So that's why you test the frequency coming off of that being, and you'll know what direction they've headed in, right?
Well, Absolutely right. And we're being bathed now in 4G and now with this 5G. The reason why this 5G is so deleterious to the human being is that it dissociates the oxygen in the hemoglobin. So when you have low oxygen, you got hypoxia. What's the basis for degenerative diseases and cancer? It's low oxygen. They're setting the stage to kill the civilization with this crap.
And I know it's a little bit off topic, so we're not going to stay there long, but just know this, like in Wuhan, China, they're talking about the coronavirus, but what they haven't been telling people, which everybody should know, or they're going to know pretty soon, is that Wuhan is totally 5G. And they show pictures of people just falling flat on their face. Well,
Absolutely.
and that's the
Well,
5G. That's the 5G.
Yeah, well, the interesting thing, you brought that up. Several months before the outbreak of the coronavirus, they turned on the 5G. So the 5G is a pulsed magnetic wave that opens up the cell membrane. So a common cold, which is like coronavirus, gets inside the cell faster with the pulsed magnetic wave. And that's what triggers off this so-called pandemic nonsense. Yeah,
Yeah, so it's a virus with a launcher on its back.
you got it.
Right. Okay. Coming back, can you give me some examples of the accuracy of some of your other testing, and can you give me some? I think people like that. They like to know about different examples and how. Okay.
Well, yeah, I basically told you about the patient with the lung cancer,
Yep.
and we test right off the pathology slide. So all my cancer patients, I have them bring in the pathology slide, and it's so damn simple, Darrell. There's no blood test in the world that's going to give you that information. Another case, we had a canine with lip cancer, and so this patient of mine, she brought in her labradoodle, and it had cancer on its lip. The Cornell Veterinary Hospital cut it off twice. Twice it grew back. So when she brought the dog in, I used the owner. I did surrogate testing. I tested the dog through the owner, and it had some viruses. It had some heavy metals and chemicals and pesticides. Without a definitive diagnosis, you have a faulty treatment plan. The interesting thing was 6 weeks after we put the dog on a nutritional program, the cancer disappeared from its lip, and it's been healthy ever since. The real interesting one, though, was a stage 4 throat cancer. Patient told the endocrinologist who was treating him with the cancer, he's going alternative. And the doctor says, oh, it's a farce. You're wasting your time. You're wasting your money. Guess what? He had 3 root canal teeth. The pathogens that were in those 3 teeth were the same pathogens in the throat cancer. Put him on a raw food diet. He had his own Rife machine. He was getting insulin potentiation therapy up in Long Island. I extracted the 3 teeth, put ozone in the jawbone, homeopathics, colloidal silver. Guess what? Three weeks, Darrell, the cancer disappeared. Hospital's own records. My patient goes back to the doctor and says, I want to talk to your other cancer patients and tell them what's available. Doctor wouldn't talk to him. My other interesting similar situation had a patient from Florida, stage 3 melanoma. Well, that's a death sentence in traditional medicine. They almost killed him with the oral chemo at $5,000 a month for a prescription. He flew up. I sorted him out, had him buy his own ozone machine. 4 months later, the PET scans show no cancer. I said to my patient, Elliot, please ask your oncologist if she wants to talk to me. I'll tell her what I did. She wouldn't talk to me. They don't want to know the truth. That's what's so heartbreaking. You have a Hippocratic oath, and they don't have enough moral standards to embrace the truth. Because if they learn the truth, now how the heck is she going to turn around the next day and keep lying to her patients?
Well, where do you think the word hypocrite came from? Okay, it's the only thing that's left of the oath. And you know what? If you take a look at the oath, everyone, if you go online now, it doesn't say do no harm. It doesn't say that anymore. So they've actually removed that. Did you know that, Dr. Smith?
No, we didn't.
Yeah.
I thought maybe they changed it to do more harm. Well, you know what I just found out? You know what MD stands for?
No.
More drugs. More drugs.
More drugs, more drugs. All right. So in chapter 2 of your book, you mentioned the 3 pillars of achieving ultimate health. Could you explain this? And can you explain it in detail, too, for our people? Okay?
Yeah, sure. Well, three pillars are detoxification, rebalance the intestinal flora, and then regeneration. So detox, come on. You know, I know, and most average person, the liver is your main detox organ. The blood of your entire body goes through to your liver every 3 minutes. So you have to feed the liver certain nutrients like glutathione and superoxide dismutase and curcumin so it could process the chemicals. So that's really important. Rebalancing the intestinal flora. Well, there was an interesting article written in 1978 by a senior chiropractic student, Alan Immerman. He tracked intestinal toxemia in the medical literature for 100 years. Heart problems, cancer, asthma, acne, anxiety, it's all tracked to a toxic bowel. Well, your intestines represent 60 to 80% of your immune system. So you have to clean out the garbage and you have to reimplant the healthy pre and probiotics so you have a good system. The third pillar is regeneration. So once you get rid of the toxins, reestablish healthy bacteria in your intestines, you got to rebuild the tissue and the organs. And you do that with protomorphogens, which are genetic blueprints provided by desiccated bovine tissue. And then the body can start to heal the damage. There's homeopathic sarcodes, which are basically remedies to reestablish normal function of the cell. And then you have to take food-based, not synthetic, food for robots, but food-based supplements and raw, so you don't destroy the nutritional value, to help rebuild the tissue. So those three pillars are like key for everything.
Beautiful. So what's the connection between a toxic bowl and dementia?
Well, it's real simple. There's two direct connections. One's the lymphatic system, which is your drainage system of the body. And the second one is your 10th cranial nerve or vagus. There's direct connections. Just like your teeth have a direct connection to your brain. Back in the 60s in Switzerland, they took dogs, put mercury fillings in their teeth. They sacrificed the dogs. In 24 hours, the mercury was in the brainstem. In 48 hours, it was in the pituitary gland. So the more toxic your bowel is, the more toxic your brain's going to be. And with inflammation, you get fibrosis and hardening of the brain and dementia.
Wow. In chapter 10 of your book, you mentioned that statin drugs are a cause for dementia. Could you elaborate on this?
Well, sure. When these geniuses, put out false information that you have to lower your cholesterol below 200, they're diminishing the cholesterol that's necessary for your brain to heal itself. So it shrinks. You get hardening of the brain, lack of circulation, cerebrospinal fluid in the blood supply, and you get dementia. It's a no-brainer, literally.
Yeah. Are there any other side effects of taking statins that you can think of?
I thought you would never ask, but thank you. There's over 900 studies, Darrell, proving the adverse effects of statin drugs. Statins, they deplete your body of CoQ10. You know what really burns me? Pfizer came out with a combination drug of Lipitor and CoQ10. Guess where it is? It's sitting on the shelf because they don't want the people to get well. So it actually causes congestive heart failure because it diminishes the CoQ10. It also interferes with your vitamin D and your other cholesterol-based compounds, like your sex hormones, cortisone, and the dicols, which directly affect the physiology of your cell. And the big thing, people get muscle pain. Why? Before statin drugs came on the scene, there were 4 cases worldwide of rhabdomyolysis or breakdown of muscle tissue. After statins came on the scene, there's thousands of cases of rhabdomyolysis and breakdown of muscle. It's ridiculous. It also damages your liver and kidneys, and it causes type 2 diabetes. The good thing about it is it generates $29 billion a year of revenue worldwide.
That's called a statin statistic, if I ever heard one. There you go.
Yeah.
Okay, so you talk a lot about energy medicine. So why is energy medicine so more effective than conventional allopathic medicine?
Well, there's 3 factors. Energy medicine is diagnostic and it's more accurate because it's defining the core issue. Whereas traditional medicine, they're not defining the core issue of the problem. Give you an example. You can take the CyberScan system that we use. It has a database of 135,000 electromagnetic signatures. In 10 seconds, it'll capture a holographic energy pattern from your palm of your hand. And then the software then compares the known frequencies of your energy pattern with known frequencies of food additives, chemicals, vaccines, pesticides, heavy metals, and it comes up with the stressors. So it's more diagnostic. It's more like a laser guided bomb keying in on the causative factors. I had a patient that had swollen liver for 27 years, and he wanted to do a liver transplant. He said, thanks, but no thanks. Using technology, he had benzene and hepatitis B in his liver. Put him on a nutritional program. 7 months later, his alkaline phosphatase is normal, and his liver is 100% normal. Now, the irony of the whole situation was for 9 years, he had a blood test every 6 months. Every 6 months, those blood tests were 100% normal, Darrell. The insurance company says, we can't insure you because you have a liver problem.
Wow.
Now, the second big area is that it's less invasive. Energy medicine is so much less invasive. When you start doing x-rays, CAT scans, MRIs, injecting thallium for a stress test, it's invasive. Thallium is really toxic like heck. It's radioactive, and they use it for the stress test. It'll cause loss of hair and all kinds of peripheral neuropathies. And that's usually within 24 hours. The symptoms can be very painful, rapidly progressive, ascending peripheral neuropathy. So your toes and your hands can get painful, and you can get numbness or paresthesia of your hands and your lower extremities, especially the soles of your feet. So these darn diagnostic tests that they're doing can create nerve damage, headaches, seizures, insomnia, comas, and death. Other than that, they're wonderful. The last thing is the energy medicine is so much far superior because it's defining what's really going wrong with the body. A perfect example, I had a young lady from Virginia, 7 years severe eczema. She would scratch it so bad it would bleed, and the pain was like out of control. The doctor told her she'd have to live with it. When she came to me and we diagnosed, she had shingles, she had a low thyroid, she had a low liver function, she had cytomegalovirus and herpes simplex 1s trapped in the skin, and plus some vaccines. I put her on a nutritional program to focus in to remove those splinters that I found. In 8 weeks, her problem cleared up completely. I mean, when you look at it, it's so much simpler and less invasive, and there's very little side effects.
Gerald, do you ever find yourself, more and more now, but honestly, and I mean this, I know we're on this show and everything, but do you ever find yourself just going, what the hell is going on? How people can be calling this therapy, and how people can continually take a therapy that they know is so toxic, so risky, and how other people have been harmed so badly, but they still do it. What do you think happened to the human race? How did we fall down so far to actually buy into these self-hate programs? Because I talk about it like this: there's only love, there's only hate. So there's only love programs and hate programs. So, the only reason why people are lining up at these hospitals and keep going to these therapies is they've got to have these hate programs downloaded to their subconscious from the minute they get here, when they get here, because I don't know how people even buy into this stuff, and the track records are so bad that everybody even knows the track records are bad, but they keep on going back for more. It's like humankind has lost total faith in their own healing ability and in themselves. Seriously.
Well, the answer is simple. It's called mind control techniques. From the time a child comes into this world until he becomes an adult, he's surrounded by fear. Oh, if you don't go to the doctor, you're not going to get well. If you don't take the chemo, which is only 2.3% effective in curing cancer, you don't have a chance to survive. It's all fear-based. Plus, they've dumbed down the population. The whole educational system is designed to dumb down the population. The average reading level is like 6th grade. So, and they're bombarded with the boob tube, the media, radio, papers, newspapers, TV, the same old big lie. Joseph Goebbels said that, under Hitler's regime, tell a big enough lie. He said, Hitler, you'll even believe it. So with this going on a daily basis, the people are afraid to move out of their comfort zone. It's like, going down to a primitive tribe and you show them a TV, they freak out. They can't relate to it. And the same thing's happening in medicine. When you explain to them, frequencies and natural remedies, they can't wrap their head around it. They can't digest it.
Yeah, and let me ask you a question. So, in the last few weeks with this coronavirus, are you getting lots of calls where people might have a little phlegm on their throat, or a sore throat, or a headache, or how many calls do you have coming in where people are? I think people are set to panic because they've been taught to panic, because as soon as they panic, they're going to go out and rush, and then they end up doing something that they regret later. So, what are you seeing there?
We see tremendous input of telephone calls and emails. And I say it's real simple. Dr. Richard Chang, who's over there in Hunan treating these cases, he's using IV vitamin C and flipping these so-called severe, corona cases. If you take 3,000 to 6,000 milligrams a day of food-based vitamin C, you'll have a minimal to no chance of getting it. So it's a scam that, they're pushing people to get the vaccine. It's problem, reaction, solution. They create the problem. They know the reaction is going to be fear. And the white knights with their syringes are marching down the street saying, we're going to protect you. We're going to inject you.
That's right. When vaccines have never been studied, and they're the most dangerous things you could ever do. And guess what? They've never been studied. And what I don't get is how many people just know they've never been studied, but they're out there just waving the flag, right?
Well, they're brainwashed.
Yeah.
They're brainwashed. And Robert F. Kennedy Jr. sued the FDA and he won in court. They not only admitted that there's no safety studies in the last 30 years, but the death rate from the vaccines is so far greater than what they've been putting out because they don't want to spook the people. I tell young parents that get intimidated by these doctors, I said, it's real simple. Ask them, can I buy a car that doesn't have a crash safety test? Can I bring my baby home from the hospital in an unsafe car seat? Of course not. But then you say to the doctor, well, you want me to inject this chemical into my child and you have no safety records for 30 years. Can you explain that to me?
Oops. So let's get back to this. So why are there so few physicians using this type of medicine that you use?
Well, that's real simple. Number one, it takes many years to develop the skills and the database of knowledge to effectively use this technology. And frankly, most physicians are not really willing to make that sacrifice. Also, the medical boards constantly scan the doctors' websites and they harass them if they're, working outside the box. But I tell them, like I'm sure you do too, if you join the World Organization of Natural Medicine, get an independent license to practice natural medicine, they had no jurisdiction over your natural medicine practice. I proved this in court 5 years ago. They tried to take my dental license away. We went to court. I had my attorney hand the attorney for the dental board a copy of the Pennsylvania dental law. And he politely asked him, he says, could you please show me in there where you have jurisdiction over Dr. Smith's license to practice natural medicine? And he read through it and he says, I don't. And he says, end of case. That was it. I didn't have to spend $1 million to defend my license because I have a separate license that gives me the right to do it. So that's one fear factor that you can easily put to rest. The other one is that doctors are brainwashed and they dangle their license in front of them. So again, it's all fear. So that's, a big problem with that. And once they get educated and start to see the results of this wonderful modality, they'll jump ship very quickly.
Yeah, I hear you. So let's get back to energy medicine. And because I got to tell you that we are finding it to be so effective when we're dealing from everything, just from, inflammation to cancer. How are you finding it with your patients using energy medicine?
Darrell, I feel like I've been beamed up to heaven We use a scalar energy device called Therify. I had a woman fly up from Brazil that had severe ulceration of her throat, pain in her throat. The doctors down there said, there's nothing we can do. It's viral. She came to me. We put her on the Therify for 12 minutes and then the Bioptron for 10 minutes. 22 minutes later, totally pain-free. It's like waving a magic wand. You know, back in the 60s, Anton Priori in France was curing almost 100% of all kinds of cancer with scalar energy. It's so beautiful. All you do is you lay down on a massage table, and we have a mat that has 16 different gemstones in it, and they're bathed in a plasma field of scalar energy and 18 healing frequencies. And it changes people's lives. It's non-invasive, quick, and easy.
All right. Well, let's talk about something else. Let's talk about vertigo. How's your success with that?
Well, interestingly, I had a woman that had 8 years history of vertigo. She was in bed for 3 years, or 3 days rather, when they gave her the medication and made her so groggy and dizzy. Anyway, about 3 years ago, she came to me. I put her on the Therify, and in 3 minutes, she got up and she said, my vertigo's gone, and it hasn't come back. Another patient had 15 years of positional vertigo. Johns Hopkins couldn't figure it out. Hershey Medical couldn't figure it out. The top neurologist. I tracked it down to cytomegalovirus in a root canal tooth on the lower left side of his mouth. 2 months later, after using the right frequencies to get rid of the virus in the tooth, his vertigo totally disappeared. So you have to define what the underlying cause of the vertigo is.
Absolutely.
And treat appropriately. Yeah.
Yeah. And that's where you're a detective, right?
You have to. You just can't sit there and run conventional tests because it's not going to give you answers. Kinesiology, direct resonance testing, whatever you want to call it, is the way to go. It's vibrational medicine at its finest. And my estimate is in the next 5 to 10 years, you're going to see a whole new wave of patients seeking this type of therapy.
Yeah, well, you know what you've done is you've made it personal. You've made it to the individual, and you're basically testing their personality to find out what their health reality is.
Absolutely.
Yeah, that's where it starts.
Well, you know, the interesting thing is one of my patients brought their dog to me because it had PST. It was traumatized physically and emotionally. 10 treatments with the scalar energy. The dog's personality was 180 degrees improved. The trainer couldn't even believe it was the same dog when they took it to the trainer.
Yeah, you know, as Einstein said, energy medicine is the future, and we utilize energy medicine more and more here because, you know, if people could just get that they are light energy frequency beings and your body's a battery and the electrical charge you take up. You know what? It's like this. Okay, the powers to be are using light and frequencies to bring our health down. What are you going to do as a person out there to bring your health back up? Well, you've got to bring in the right light and the right frequencies to negate all this stuff that they're doing. What do you think, Gerald?
You're 100% correct. And that's why you can't continue a lifestyle of fast foods, processed foods, synthetic chemicals, putting it into your body. You're not a robot. You know, Fritz Albert Pop, was nominated for a Nobel Prize because he discovered food has biophotons. And that's why food-based supplements heal, because they have biophotons. That's the energy that the tissues need. You know, the sun puts out scalar energy. The plants absorb the scalar energy and store it in biophotons. You eat the raw plants, you get the biophotons, you heal. You start putting mercury fillings in your mouth, gold fillings in your mouth, titanium implants in your mouth, root canals in your mouth. Guess what? It interferes with the body's ability to absorb the biophotons and energy from your environment. And that's why people are so damn sick today.
Gold. I never knew that about gold. I thought that gold was gold, but it's not gold in your mouth, eh?
Well, no, it acts as an antenna pulling the EMFs into your body and dehydrating it.
Okay. All right.
Plus the galvanic reaction. So let's say you have a 3-unit bridge in your mouth, 3 gold crowns. Well, the way they make them is they make the gold molten, and they spin it into a form like a cast. Well, the ratio of the components in each crown is not exactly the same. So even when the same gold that was used, you're still going to get electrical currents, galvanic currents in the mouth from that bridge.
What would you use to make a crown then?
I like zirconia. It's a crystal. First of all, just think about the density of gold. You put in 4 crowns in your mouth, it's going to affect your head posture. Dentists don't factor that into the healing equation. They don't even realize it. Zirconia is strong as gold, and it's light, and it feels natural like your teeth.
Where in the heck would I get zirconia? And then what dentist would even do that? You would do that, or would someone else do that?
Well, yeah, dentists are using it now, but
Are
it's a
they?
smaller percentage. Oh, yeah, but it's the only way to go.
Wow. Is there any other secrets you've got up your sleeve that you could tell us right now?
Yeah, never trust a doctor who has dying plants in the reception room.
Okay. All right. Okay.
Yeah, the big pearls is get good oils in your diet, organic, cold pressed, especially omega-6.
Yeah.
You can all the best supplements in the world, but if your cell membranes are like plastic, it's not going to get through into the cell. You have to repair the cell membrane. The interesting thing is, a little over 2 months ago, I went to London to take a course, and I stepped into another seminar, and this guy was doing a Russian diagnostic system electronically. He asked for volunteers. I went up. He did a whole body scan on me. He then turned around. He said, "How old are you?" I said, "I'm 76 years old." He said, "That's pretty miraculous." He said, "There's nothing wrong with you." I said, "It's not miraculous. I understand how to rebuild the body from the cell membrane up. And that's what I've been doing for the last 10 years. And there's no big mystery." And I gave him a 4-minute Cliff Notes version. Darrell, you know the secrets: real food, real oil, good positive affirmations, get involved in life and do something.
That's
That's what
right.
it's all about.
That's right. Get excited about yourself. That's the big one. Really get excited about yourself and know that that which created the universe totally loves you and has never judged you. And stop judging yourself and just get on with your game. Find your passion, find your purpose, and don't let anybody stop you from living it, whether it's your family, the friend, the world, whatever the case may be. You know what? This is your party. And nobody likes a party pooper, eh, Gerald? I want to talk about party pooper for a second. What about
Sure.
headaches? A lot of people with headaches now, Gerald. What do you think about that?
Well,
Migraines,
we give,
especially.
we give them. If you don't have a headache, I can guarantee I can give you one. But all kidding aside, there's only about 400 reasons for headaches,
Yeah.
and you have to play detective. I had one young lady fly up from Trinidad, 20 years severe migraines, tried every pain medication there was in the PDR, physician's desk reference. When I took a history, she had 2 concussions and 3 whiplash injuries. I adjusted her cranium to reset the sphenobaselar mechanism. That's the base of the skull. And guess what? She walked out without a headache and never came back. And that was 5.5 years ago. She also had an alcohol trigger. So when I detoxed her liver, she can now drink sociably, and it won't trigger a headache. So that's one main thing. It's structural. I had a patient who had headaches, for I think it was 15 years, and it was coming from a B vitamin deficiency. I put her on natural B vitamins, end of headaches. We had another young fellow who had gallbladder problems. When I cleaned out his gallbladder, guess what? He had no more headaches. So you can get headaches from low thyroid. They're worse in the morning, get better as the day goes long. You can have headaches from exhausted adrenals. You can have tension headaches. This being too acidic, your muscles tighten up for tension headaches. Hormone imbalances, when the thyroid's low, you get estrogen dominance. You just kind of have to play detective and define what the heck the underlying cause is. And once you remove it, the headaches disappear.
Yeah, and it doesn't hurt to get somebody like you that's been in practice for so many years, because we've had a lot of time to fall down and pick ourselves up and figure it out, right?
Yeah, it's a game, and it's a long journey, and you just keep flipping the rocks. The answers are all out there, Darrell, as you well know. And you just have to be persistent. And it's no different with life. It's a journey. If you don't pick yourself up, you stay down and you're going to, woe is me. You're the victim. You got to change that whole mentality.
Yeah. So basically, what you're saying is you like to have fun all the time, right?
And I do have fun all the time.
Yeah, I bet you do. Well, you don't look this good and live this well when you're not having focus on fun, and that's what we need to do. Everybody out there, it's all about smiling, it's all about laughing, but it's all about how long does it take you to get back into love with yourself when things don't go your way or they don't go the right way. So, Gerald, how long does it take you to get back there?
2 seconds.
2 seconds. That's right. That's right. All right. So, Gerald, where can people get your book?
Uh, I have several websites. One's icnr.com and the other one is ghsdoc.com. And they can download the book. And for those people that want a hard copy, they can order through the office. We have a printed version. But all I can tell you is that it's a game changer once you open your eyes to what's really going on. And that's the excitement to me. I wrote the book to give people another perspective on healing as opposed to the cover story that they're getting from their doctor.
Right. Can you give them the name of the book again, because so they don't have to go back and listen if they didn't write it down?
Yeah, sure. It's called Remove the Splinters and Watch the Body Heal. It's so obvious. If you have a splinter in your finger, you could put all the mercurochrome, iodine, neosporin. If you don't remove that irritant, it can't heal. And it's the same thing with the body, whether it be heavy metals, pesticides, herbicides, chemicals, you got to remove it.
So, what does the future look like in dentistry, and what does the future look like in health to you? What do you see?
Well, I see a lot of holes in dentistry.
Yeah.
Only, but no, basically, I think the people are starting to wake up. It's a slow process. Yeah. And because we get over 300,000 hits a year on our website. I have a ton of articles. I'm sure you have similar things. I give away free information as much as possible to enlighten people, to show them the truth. Because once you have the truth, you can't, it's like Einstein said, once you stretch your brain, you can't go back to its original, position. So that's what I'm all about, is educate people, tell it like it is. And, you have to be indifferent like a candle. A candle gives off light to those who want it. Those that don't want it, that's okay too. I don't get bent out of shape anymore.
So let me ask you another question. When did you realize that life was a game? And then when did you realize on how to play it?
Interestingly enough, about 8 years ago, when my wife was on her way out by her own choosing, I took Kabbalah up in Manhattan. I took 30 classes and studied 30 or 3,000 years old wisdom. And they said, basically, life is perfect the way it is. You're just trying to screw it up. And you have to understand something. We come into this life naked, and you die with a suit on. So you're ahead of the game when you leave.
Hopefully it's not a rental. They'll come and get it. They'll come and get it. But no, the reality is I think that we don't realize that we actually opt into a life. How can I say this? A life-challenging, fun-filled adventure, and then when we get here, we have a huge tantrum. And I think we got to give up the tantrum for being the hero of our story, like you're doing, Gerald. And I do know this because I know this from a lot of my colleagues, and I know this from a lot of people that have come and taught by you, and even my brother Marcel, Dr. Darrell Wolfe. I mean, everybody sings your praises, and God bless the world for Dr. Gerald Smith. And you know what? It's been a really beautiful interview, and I love you to pieces. Okay.
Thank you so much, and we'll be seeing you shortly up in Markham.
Yeah, everybody, we're all going to be in Markham, Ontario, and we're going to be there April the 30th until May the 4th, I think it is. And just come and see us, because we're there to teach, we're there to train, and we're there to give you your power back. Anything you'd like to add and just say to everybody before we say goodbye?
Just take charge of your life. Don't be like a cork on the ocean. Just take charge. There was a study done in Germany years ago, and they interviewed centenarians. And the two common denominators that they found amongst these people 100 years plus in age was, one, the ability to say no to people. So you're in control of your life. The other one was, do the things that you enjoy on a regular basis. It had nothing to do with how much exercise or how many vitamins you took or how many yoga poses you could do. It's all about saying no and doing the things you really enjoy. And that, to me, is a big plus.
Yeah. I there was a time in my life where I needed a house, I needed a car, I needed all this stuff. Well, I still would like to live in a house, but the reality is that, you know what? The more that we can realize that the present moment holds everything for us, that was a beautiful breakthrough for me. Thank you again, Dr. Gerald Smith.
You're welcome. Thank you.
You're definitely a light that shines upon the world, my friend, and I will see you in Markham, Ontario in just a short bit.
Thank you so much.
Thank you, sir. Well, thank you for joining us, everyone. You know what? You make this show what it is, and just know this, okay? You may not believe everything you hear, okay? But the reality is just put it on the shelf. Let it sit there. Be patient with yourself. Don't let your subconscious rule, school, and fool you. Be open to change and ask yourself, will this new belief give me a better life? Will it make me happier, healthier? That's all you got to do. And then stay connected to the Lionheart breathing. Take breath in, breath out. Stay in the present moment, because I know you got this, okay? It's your life, and you're allowed to love yourself totally. You're allowed to love your life totally, all right? And don't forget, everyone, every Monday, you can join me for my DocTalk live Q&A, where I will answer all your questions live from YouTube, Facebook, and Intercom. When watching on YouTube, don't forget to subscribe below and make sure that you click on the bell to enable notifications so that you never miss a show. All our shows and our Q&As are time-stamped, so you can go to even the questions that I asked today of Dr. Smith, and you'll be able to go right to that question, and he will give you the answer that you've been looking for. So all our shows are done that way to make it easy for you. Also, if you wish to listen to the audio version of any of our shows, you can find us on iTunes, Spotify, and SoundCloud. Again, thank you, Dr. Smith, for joining me, and all our listeners who make this show possible. God bless everyone out there, and know that you can have the best day every day. 3, 2, 1, take your power back, and this time keep it. If you're looking for life-saving and life-changing information, well, you've come to the right place. Don't forget to click and subscribe. Stay connected.